You go ahead.
Oh, no, I was just gonna say there's a possibility I have to pop out for like a second because our office admin is late today. She locked her keys in her car, so I locked the
Oh,
front door and I don't know if she has the keys or if she's
that's all
Ubering.
right. That's okay. Yeah, if you have to jump out, then I'll just tell everyone, okay, go refill your coffee, go to the restroom, and come back
The
in
door
30
is like
seconds.
it's right on the other side of this door, so it'll take a second.
Perfect. All right. Well, we have some people that have started to join us. So, hi, you guys. Thank you so much for being here with myself and Rebecca today. We're so excited for this discussion. Um, if you will, in the chat, let us know where you are dialed in from. We just like love to know where everyone lives, and it's always just kind of fun to see where everyone is coming from. So let us know in the chat where you are. Sometimes they go Bay Area, California. Okay, my co-founder is in the Bay Area. He's in Walnut Creek. So I don't know, Brooke, if that's near you, but um, welcome from the Bay Area.
I moved to Austin from San Francisco, so the Bay Area will always have a soft spot in my heart.
Nice. Scranton, Pennsylvania. Nice. Hi, Kathleen.
Hey, I can't see these. Am I supposed to be able to see these?
No.
Wait.
So we've got the coasts covered, Bay Area, the Texas coast, which I don't really recommend anyone visiting,
Not right now.
and New Jersey, Scranton, Pennsylvania, and Westville, New Jersey.
Love
Amazing.
that.
Let's see. Orange County, oh, another beautiful coast. Welcome. I wish I was in Orange County right now and not in Austin, insufferable heat. So I was talking with one of my friends yesterday. She's in Chicago. I'm in Austin. So she's like in one of the cities with like the worst air quality in the world right now, and you and me are in like one of the hottest places in the world right now. So lucky us.
It's been a
Oh, there's someone from Chicago. How is it over there, Elizabeth? Are you staying inside? Has it cleared up at all? Man,
Are
you
they, is
guys,
Chicago also affected by the fires
yeah, the air quality just,
right now?
yes. Um, okay, hold on. My desktop is up. You can see my desktop, Rebecca?
Yes, yeah, actually I can. I
Oh,
wasn't sure if it
weird.
was just
Um, hold on. Everyone can see my very messy desktop. Hold on, let me see if I can, I'm gonna stop sharing and
it
see
looks
how I
much
can
better
fix
than
this.
mine, so
Um, Elizabeth, stay inside all week. It's smoggy for sure. Ugh. Okay, I'm gonna stop sharing. Oh, maybe that's why.
there we go.
Okay, perfect. Thanks. Thanks for the alert, guys. Okay, so I'm going to launch a poll, and if you guys will just take this quick poll, it's just helpful for Rebecca and I to know where you are sort of like in this life phase. And I'll let you know what people are selecting. So right now, Rebecca, of the people that are with us, 80% are expecting their first baby. 10% are expecting their second or third. And the rest of the folks are new parents.
Nice.
So anyway, okay, so most people are expecting their first. We've got other veteran parents in the room and then new parents. So this is great. Thank you guys for that data point. I will launch it towards the end of the session just so we can capture some more data from everyone that's joining us. But let's go ahead and let me just see if there's any. Okay, so if you're joining us, let us know where you're from, but otherwise, let's get started. Okay, thank you guys so much for being here. This is our fourth webinar in our solicited advice series, and if you are wondering why on earth we chose to call this series solicited advice, well, it's pretty self-explanatory, especially for the new and veteran parents. When you are expecting a baby, without fail, we can all agree about how much unsolicited advice we will receive and continue to receive after a baby. So we just sort of like love this idea, like if there's like one common thing we can all agree on, it's the unsolicited advice. Therefore, we wanted to create this series of solicited advice that like we actually need. Like what is the stuff that we know we need to learn about, but like information sort of like parsed all over the internet. You don't really know sources of truth. And like, what are some like just tangible things as expecting parents and families like we can learn and help? So welcome to the Solicited Advice series. And our discussion today is on pelvic health. And I am so excited to introduce you guys to Rebecca. But Rebecca, let us know who you are, where you're from, give us a little intro, and let people know like a little bit more about you before we dive in.
Yeah, for sure. Well, my name is Rebecca. I'm a pelvic floor physical therapist, and I own a practice called Ladybird PT that specializes in perinatal health. So pretty much all we do is help people manage pregnancy pains, prepare for birth, recover postpartum. And that might also mean that we're seeing people 10, 20 years postpartum, but we really do manage pelvic health across the reproductive spectrum. And I've been a pelvic floor PT working in this specific specialty for 6 years, which is kind of hard to believe. And I moved to Austin. I'm in Austin, Texas, and Ladybird's in Austin from San Francisco, but I'm actually from Pennsylvania. So I love that we have people from both coasts because I kind of represent all the coasts now, except for the northern one, I guess. But I'm really excited to be here talking about pelvic health, especially talking about pelvic health and how we can support it through pregnancy is like my favorite soapbox. So I am always happy to talk about this. And I was really excited to be here when y'all invited me. So thank you for having me.
Yeah, we're so excited. So we have so many questions to get through, and some people actually submitted them on our Instagram before this session, but I just want to let everyone know that's on the call. This is the most registrations, pre-event registrations we've ever had, ever. This is our 4th webinar, but still, which is so interesting. We had a session on doulas, a session on, you know, building your registry, a session, what was it? I forget, but why do you think that is? Like, before I answer, like, we go into all these questions, like, what do you think it is about pelvic health or pelvic floor that has so many people intrigued and interested? Like, I would just be curious, like, from your perception, why do you think this is like the hottest webinar we've hosted?
Yeah, are you asking me or are you asking?
Yeah, I'm asking you. Like, what is it?
Yeah, I mean, listen, I think pelvic health is not new, right? Pelvic floor
Yeah.
physical therapy is not new, but it is relatively new in public awareness, and it is definitely gaining popularity in terms of how much people are talking about it and whether or not it's becoming kind of like an expected and a normal associated with pregnancy and postpartum recovery. So I think that it is new enough to public awareness and public perception that people are still like really excited about this thing that they didn't know existed that can help with these really common, pretty massive issues and symptoms. And then at the same time, it's not ingrained enough and it's not old enough news yet that people are like, yeah, of course we know. I think there are still a lot of people out there who are hearing about it for the first time. And sometimes that means they're hearing about it for the first time 5, 10, 15, 20 years after they have babies. And I think that our generation of pregnant and birthing people, and maybe actually I take that back. I don't know anything about previous generations in terms of like conversations that I've had with people outside of just my really close network, but our generation is having a lot of conversations with their mothers and their grandmothers about what their experiences were like. And yet we're still kind of isolated enough because we're no longer, most of us are no longer living close to those people. And so we're hearing these stories and we're learning that those stories don't have to be our story. And then at the same time, we're learning about this thing that can help. So I think pelvic floor PT is just kind of like having a moment, and I think it deserves that moment, but I think that that's why.
Amazing. Well, thank you. So I want to just remind everyone, if you guys have any questions during the next 30 minutes, please ask them in the chat. This is going to be a discussion. So please, if something comes up and you're like, I have to have this answered before we go, please put it in the chat, the question section. We will get it answered for you. So this is just meant to be like a really fluid discussion and hopefully extremely helpful. So just want to remind people, please ask questions. So I'm a mom of 2. I have a 4-year-old and a 1-year-old. And it wasn't until recently that I started to learn about pelvic floor. However, if someone was like, Sarah, what is it? I would not be able to tell them what it is. So please, for all of us on the call, can you just give us like a 101? What is the pelvic floor? Why does it matter? Like, what is it?
For sure. This was not planned, so I'm kind of excited This was right at my feet.
Awesome.
I'm in my treatment room. So your pelvic floor is a bundle of muscles. When we talk about the pelvic floor, we are talking about a group of muscles, the same way we would talk about like the rotator cuff. We're talking about a group of muscles around your shoulder. So the pelvic floor is a bundle of muscles that sits at the bottom of your pelvis. It spans from sit bone to sit bone and then from pubic bone to tailbone, and it surrounds your urethral opening, your vaginal opening, and your anal opening. There are three muscle layers. There's a superficial pelvic floor layer that all of us can feel externally. If you feel through your labia, if you feel at your perineum, once you push through that fatty tissue and that skin, you're feeling pelvic floor muscle. And then there are deeper layers where you have to insert a finger vaginally or rectally to get to touch that do the same thing. But these muscles basically all work together to do a bunch of different things. When we're not pregnant, they're also very important. They just play a slightly different role for pregnancy and birth. So this group of muscles is responsible for keeping pee in, for keeping poop in. They're responsible for letting pee out, for letting poop out. They're responsible for orgasms. They're responsible for hip rotation, for pelvic and lumbar stability. They're part of your core. And then during pregnancy, they're responsible for holding all the extra weight as baby grows, as uterus grows, as the placenta grows. And then they're also responsible for relaxing and getting out of the way to allow for a vaginal birth. So it's just a group of muscles, but it's a group of muscles that does some really important core health things for people who've never been pregnant and also for people who are pregnant.
Okay, well, I just learned a whole new world. Thank you. So this someone just asked a question, it's perfect. Is there a way to evaluate the strength of your pelvic floor before giving birth?
Yes, yeah. A big part of what pelvic floor physical therapists do is evaluate the strength and the tone and the coordination of the pelvic floor. So a lot of people are tied up in strength. They're like, how strong is my pelvic floor? Does it need to be stronger? But strength is only one part of the puzzle. So yes, we can absolutely evaluate strength. We do that by inserting a finger vaginally and then testing how strong you're able to activate those muscles. The same way where if I wanted to strength test your bicep, I would see how much weight you can hold, how much resistance you can hold. And we can do that at any point in the lifetime. We can do that pre-pregnancy, during pregnancy, postpartum. But then at the same time, while we're evaluating strength, we're evaluating whether you actually know how to activate those muscles. Because like you just said, so many people don't know what the pelvic floor is. So if you don't even know it exists, how are you going to know how are you going to know to use it the right way? And then the last thing that we can look for is there enough flexibility in the tissue? So I always like to use my bicep as an analogy. So for instance, my bicep, I care about more than strength for this muscle, because if I want to drink water, I need the flexibility to extend my arm to reach my water bottle. I need the strength to then bring my water bottle to my face, but my brain also has to send signals to my bicep so that it knows where to find my water bottle in space and then where my mouth is. If any one of those pieces of the puzzle isn't working, if I'm not flexible enough to reach it, I can't drink. If I'm not strong enough to lift it, I can't drink. And if I don't know where my face is, I can't drink. And so your pelvic floor is the same way. We need all three of those factors to be in line for it to be happy and functional.
Okay, so determining the strength of your pelvic floor, that's not something you could do at home by yourself, or is it?
You can get a general sense, maybe, depending on how much body awareness you have, really depending on how much body awareness you have. So what you can do is you can insert a finger vaginally and you can try to do a Kegel, squeeze like you're holding back gas, squeeze like you're holding back pee, and see if you feel your muscles tighten, see if you feel your muscles push. What you're looking for is a tightening and a lift. You're not going to be able to evaluate the strength of the muscle because you're not going to have, say, 100 other bodies to compare to, but you will be able to tell whether your muscles activate or relax. So you'll be able to tell whether that coordination piece is there. You'll be able to tell if you can actually contract the muscles.
When do you start to see patients, and specifically like in the pregnancy journey? Like at what point do you recommend people start to seek a PT therapist?
Yeah, it varies a little bit. It depends on how much guidance people are looking for. It depends on whether they're going into pregnancy with pelvic floor dysfunction, which we know roughly 30% of people do. So in a perfect universe, I would love to see everybody pre-conception. The reason for that is because we can't do a pelvic exam through the first trimester for most people. It's just contraindicated, mostly because of liability, but most PTs won't do it. So if you're going into pregnancy with any underlying pelvic pain, leakage, any symptoms, then ideally we'd want to see you pre-pregnancy so that we know where you're starting and we know where what you can start doing to work on it. If we're not seeing somebody pre-conception, I love to see people at the beginning of the second trimester, whether they're experiencing symptoms or not. And if somebody's like, I'm like pretty lax, this is not a big priority, then I would say like 25 weeks is when you want to see a PT. So depending on your background and depending on kind of like how much support you want, how much time you want to invest, say 25 weeks is like really the latest I would love for somebody to start, and then as early as prior to conceiving.
Okay. And then are there like common symptoms that you see in your patients that come to see you postpartum? So I didn't think I had an issue with my pelvic floor. I was on a tech with my friends until I went to a trampoline park with my 4-year-old a couple weeks ago. And when I jumped up on the trampoline, I urinated coming down. And I was like, I am 35. I just wet myself, you know. However, Zoe's 1, Amelia's 4, but I was like, wow, I think it's not as strong as I thought it was. It was
Sure.
wild. So like, yeah, I guess I would just love to know, and I think people on the line would love to know, uh, what symptoms do you see of people that come to see you postpartum? Like, how would someone know that how would someone know to come see you postpartum?
I'm going to answer those as two separate
Yes.
questions.
Yeah, please.
Floor dysfunction, pelvic floor symptoms are incredibly common postpartum. Statistically, 1 in 2 will have some pelvic floor symptoms. So for anybody who is pregnant or through their postpartum recovery is like, oh my God, I'm alone and experiencing X, Y, or Z, I promise you are not. People just aren't talking about it. 50% is a lowball estimate. We obviously don't know about all the people who just aren't reporting that they're having symptoms. So some of the most common reasons people come to see us after baby are having urinary incontinence. Sometimes that's like every time they cough or sneeze. Sometimes it's just when they run or just when they jump on a trampoline. So that's the thing. People also sometimes don't know that they have leakage until 8 or 9 months when they're finally back to running or back to trampolining or whatever. We see a lot of people for pain with sex postpartum, a lot of people for weakened or inability to orgasm postpartum. We see a lot of people for pubic symphysis pain, so pain in the front of the pelvis, or SI joint pain, pain in the back of the pelvis. And then prolapse is probably the next like most common category. So heaviness in the pelvis, feeling like your vagina is falling down, like there's a weight in your vagina. Those are some of our most common symptoms. And then you asked the second question that I wanted to answer separately and I cannot remember it. Common symptoms, and there was something else. Maybe it'll come to
Yeah, I think it was 2. I was just like, you know, what are some reasons that people would come see you postpartum?
Yeah, so
Okay.
those are reasons that somebody would come
Yeah.
see us postpartum, but I always like to just like talk about what pregnancy does to the body at baseline, because there are people who give birth and feel great. And that's amazing, right? Like I'm here for those people. That's incredible. But oftentimes people who give birth and feel great, they're asymptomatic. So no leakage, no prolapse, right? Because let's say that's the other 50% of the population. I think it's less than that, but let's just call it 50%. Your body has still gone through many months of pregnancy. That's progressive stretching and loading on your abdomen and your pelvic floor, and then childbirth, whether you give birth vaginally or via C-section. Either you have a major abdominal surgery or you have, vaginal birth is a highly traumatic pelvic floor event. And so even for those people who are asymptomatic, if we are completely ignoring, say, the 10 months of stress that their body has undergone and not rehabbing them from that, even if they're symptom-free, we see increased risk of symptoms occurring with future pregnancies, with menopause later in life. And so truly, I think everybody should be seeing a pelvic floor physical therapist after giving birth, because there is absolutely no way that your body is unaffected. But the symptoms are the thing that often brings people in. In our practice, about 20% of our patients are coming in postpartum asymptomatic, just like want to see what their baseline is, what they can work on as they resume physical activity and as they prepare for future pregnancies though.
Okay, so this is like the perfect segue. Someone said all the symptoms that you described, like the weight in your vagina, the urination, like all the symptoms that you described, are those all inevitable? It feels like we hear older birth givers saying that's just the norm.
Yeah.
So it's not, it's common, but it's not normal, right?
No, I mean, these symptoms are largely, I never want to say entirely preventable. We
Yeah.
cannot control birth. We cannot stop symptoms or birth injuries from occurring, but we can certainly reduce the risk. We can certainly reduce the severity. There's a lot of evidence, for instance, that treating leakage during pregnancy will make you less likely to leak postpartum, that treating pubic symphysis pain, SI joint pain during pregnancy will make you less likely to have them postpartum, that treating prolapse after first birth reduces the likelihood that those symptoms get worse after a second birth. So there is a ton that we can do about this. And that's why, I mean, and obviously I'm a pelvic floor PT. I recognize that I have a bias around pelvic floor PT, but PT can be preventative. And like I said, there's no way that pregnancy doesn't place significant stress on the body. And so we can do a lot of work preventatively through pregnancy to reduce the risk of severe tearing during childbirth, to reduce the risk of a C-section, to reduce the risk of incontinence, pelvic pain, prolapse postpartum. And so, yeah, there's a lot that we can do to reduce risks, even though we cannot guarantee that they don't occur.
Right, right, right. So, so you shared some of the symptoms postpartum. Seeing a physical, like a pelvic floor therapist postpartum, is that something that would need to be cleared by like our OB, a medical provider? Or if not, how soon after could we start to see someone like you postpartum?
Yeah, so the earliest that we'll see people postpartum is 3 weeks typically. If somebody's having a lot of pain, heavy symptoms, they're really uncomfortable, they can come in day 2. There are certain things we won't do, but there's no reason that physical therapy holistically isn't appropriate. Other folks will choose to wait until after their 6-week visit when they're cleared by their OBGYN or their midwife, because then they can have a pelvic exam. We won't do a pelvic exam at 3 weeks. Whether or not you need a referral from an OBGYN or a midwife or any MD or chiropractor even varies state by state. So in the state of Texas, you can see a pelvic floor physical therapist with no referral for up to 10 days, which means when you come in to see us, you can have an eval without a referral, but we'll need one 2 weeks out. But in California, where I used to practice, I think it was like 30 or 60 days. I can't even remember at this point. So it really, that varies state by state, but it is typically very easy to get these referrals because OBGYNs, midwives, chiropractors at this point are all aware about pelvic floor PT for the perinatal population. And so it's typically not much of a hindrance.
It's so interesting. I've had 2 vaginal births, and at my 6-week checkup with my OBs after both my girls, neither one of my doctors even like brought up physical therapists or even like recommended. Do you feel like that's changing? Are those questions that we need to start asking when we go
Yeah.
in postpartum? Like it's just, I know it's not necessarily their job, but there's so many things happening at that 6-week checkup. We're brand new parents, we're sleep deprived, our body's hurting. We might be having like already like these pelvic floor symptoms. I mean, there's so much happening. And so what's your recommendation to new parents that go in at that 6-week appointment
Yeah.
to see an OB?
Yeah. I mean, listen, we are across the board failing new parents in the United States. We don't have support set up for, I mean, of any kind, right? Like we don't have financial support set up. We don't
Right.
have physical, emotional support. We don't have, barely have health support set up. The ACOG just decided that, or just released a statement that 3-week postpartum visits should be recommended and that we shouldn't just be waiting 6 weeks to see our patients, right? We don't have mental health support the way that we need it. The reality is that a lot of great OBGYNs are starting to recommend pelvic floor PT, but probably not unless patients are specifically complaining about a symptom that they might not even know is treatable. And the other facet of that is that OBGYNs are seeing 60 patients a day sometimes. So
Yeah.
they do not have the capacity to show up fully for every patient. And that is not a slight at OBGYNs, that is a slight at our entire medical system. OBGYNs went into their profession because they care really deeply, but they are so incredibly overworked.
Mm-hmm.
So I do think that if pelvic floor physical therapy is something that people want, it's actually really important to, I mean, listen, it's never too late. So you can ask for a referral for PT at absolutely any time, even many years later. But I actually recommend that people set up that appointment during pregnancy, because during pregnancy, whether or not you have an older child or not, you do not have an infant and a newborn. You're not as sleep deprived. You're maybe not yet battling postpartum anxiety, depression. Maybe you're not experiencing pain, maybe you are. But the other piece of this is that pelvic floor PTs across the country have a long wait list. We're also really booked. And so if they have a 4 to 8 week wait list, calling during pregnancy will allow you to schedule that postpartum appointment for when works for you, when isn't too early in your day, when isn't too late, when you think you can set up child support, or when your partner can be home with baby. So really, I think the best time to do that is when you have the capacity to think about this, which is typically during pregnancy, rather than waiting until postpartum. Oftentimes when people call us for the first time in the early postpartum days, they're so overwhelmed and they're so sleep deprived that it just feels like a thing that's adding on to the challenge
Yeah.
instead of taking away. And so while obviously I push to see people early, because I think that there's a lot that we can do to support healing and prevent worsening of symptoms and yada yada, at the same time, if you are in the postpartum recovery and you're like in a fog, inundated, don't have the time, energy, there is no reason that you can't start PT at 3 months. But all of that is to say, I generally recommend you set up that eval during pregnancy.
Yeah, really smart. So, a question from the audience. This person said, I didn't realize SI joint was a symptom of pelvic floor dysfunction. Can you help explain how that happens?
Yeah. That's a great question. So oftentimes when I talk about pelvic floor dysfunction, really what I'm talking about is pelvic dysfunction, right? Your pelvic floor is just part of the pelvis, but your actual pelvis is this bony structure. Your pelvic floor muscles play a huge role in supporting this bony structure, as does your abdominals, as do all your spinal stabilizers along the back. But anything going on in the pelvis, because of, look at where these muscles are attaching along the pelvis, can be a result of muscle weakness, muscle tension, inability to coordinate these muscles. And the other thing about pelvic floor PT is pelvic floor PT is really a misnomer. As a pelvic floor physical therapist, I do not just work with the pelvis. My evaluation looks at rib cage positioning, lumbar spine mobility, pelvic alignment, lower body strength, glute strength, foot positioning, gait. So your pelvic floor PT is going to basically be, ideally, a good orthopedic physical therapist who has the ability, training, knowledge to assess, evaluate, and treat the pelvic floor, so that we can treat your whole body rather than looking at this as a pelvic issue or a back issue, because your leg bone's connected to your hip bone. It all works as one.
Yeah, thank you. If we did not have experience or issues with our pelvis for our first pregnancy and or postpartum, are there exercises and other things we can do to maintain pelvic health, to prevent, any future issues with a PT? Are there exercises we can do at home? What do you have resources around that? Do you have resources on your site? Like, what are things that we can do if we haven't necessarily experienced it the first time, we're pregnant again, would like the same outcome?
Yeah, for sure. I mean, I think that first of all, I'm a big proponent of exercise. There is no exercise that is pelvic floor safe or pelvic floor unsafe. Exercise is great for our body generally. What the research shows us is that if you have good pelvic floor coordination, sorry if you hear a baby crying in the background,
So cute.
that is not shocking for this group. Research shows that if you have good pelvic floor coordination, strength training of mostly any kind will also strengthen and support your pelvic floor. Research also shows if you have poor pelvic floor coordination, strength training and exercise may be stressing your pelvic floor. The other thing is that I don't know at baseline whether somebody who's asymptomatic has good strength, has weakness, has muscle tension. So there's really no like, do these 5 things, this will be right for everybody. But every individual person comes with their own kind of like pelvic floor baseline. Just like I'm sure some of us here are jaw clenchers and have tight jaws. I'm sure some of us here have chronically tight shoulders. I'm sure some of us here are just really bendy and can like put our hands flat on the floor without ever stretching. Everybody's genetic makeup is a little bit different. So depending on what your genetic makeup looks like, what you can do to support your pelvic health will vary. But with that said, if you're like, I think I'm somebody with pelvic floor tension, you probably need to work on pelvic floor relaxation. If you're somebody who has maybe more laxity, strengthening might be more appropriate for you. We have tons of resources on our website, from childbirth education classes to postpartum workout programs to a prenatal program that I think we're going to launch in like 2 weeks. So there are all sorts of online resources, but I think if you're really wondering, like, what can I do to reduce the likelihood that things continue or that things develop in the future, I would say see a professional who can evaluate you and give you an understanding of like, well, this is your genetic makeup. You are bendy, you are tense, you can do these things to support yourself.
Okay, so follow-up question to that is, what should we look for in a PT therapist if we are trying to find one in our area? What questions should we be asking? What should we be looking for? What's important for a therapist?
That's a great question. So I think first and foremost, the best way to figure out if there is a provider that you can trust would be to call your doula, call your midwife, call your OBGYN, and ask which pelvic floor PT they recommend. Because it can be really challenging to figure out who has a pretty website and who's trained really well. And so I think going off of referrals is always a great place to start. You can do the same thing a lot. There are so many new parent or mom groups on Facebook for local areas. Same thing, you can crowdsource there and see where people have gone. I know that people are always so happy to share pelvic floor PTs in our local groups. The next thing that you can do is Google it and see pelvic floor PTs in my area, click through a few websites, see what kinds of things that they treat. Is it a practice that does ortho and neuro and vestibular and pelvic floor, or is it a practice that specializes in pelvic health? Because if you're going to a practice that specializes in pelvic floor PT, you're probably going to be working with a therapist or therapists who know what they're doing. And then the last piece is call the office, ask them questions, ask how they treat certain conditions, ask what their treatment philosophies are, because everybody's a little bit different. Our practice, for instance, believes really strongly in integrating this orthopedic and pelvic lens. We get our patients moving. We don't do Kegels laying on a mat. That is a really core part of how we believe the body works and how we treat. Other practices do it differently. They might use biofeedback or different types of machines or PT aids instead of having you one-on-one with a therapist the whole time. But if I could pick one way to do it, I would say ask your OBGYN, ask your midwife, ask your doula. They're great resources.
Okay, awesome, thank you. Okay, so we are at like the last 15-minute mark where we like just totally, we let people ask a bajillion questions. People have been asking this whole session, which is amazing. So if you guys have, if there's anything that Rebecca said, like, oh, I want her to like expand on that, or anything we haven't answered yet that is like burning that you need answered, please submit it. So while those come in, I have a note here from our pre-webinar meeting. Not a specific question, it's just a note. You were like, don't let me forget to talk about this. And here's what I wrote. C-section rates, unplanned C-section, how it alters recovery. You didn't want to forget to talk about that, but I don't know what the specific question was.
Yeah, that's okay. That's okay. I'm really glad that you brought it up. I was actually just thinking about that. I always feel like it's a disservice to get off of any call talking about supporting your pelvic floor that's talking about postpartum recovery without touching on C-sections, because the reality is that 30% to 35%, depending on where you are, of people will have a C-section. Regardless of what you plan for your birth, regardless of what you've done to prepare for your birth, C-sections occur in this country at around a 33% rate. And oftentimes people are really, really disappointed when they have a C-section if they weren't prepared for that possibility. So I think it's always useful to tell every single pregnant person, hey, there's a 30% chance. There are things that we can do to reduce the likelihood, like making sure that you know how to push, like working on pelvic floor mobility, but there's also the reality that C-sections are just a life-saving procedure and that we are grateful for them and they are necessary sometimes. And so as you think about postpartum recovery, if you have a C-section, and if you don't want to think about it and you don't want to consider it, that's okay too. Just like think about this for a friend and you can use it later if you need it. But C-sections don't dramatically change the rate of recovery, the timelines of recovery. People are still typically cleared for sex and exercise at around 6 weeks postpartum after a C-section. We still see a significant reduction in pain over the first month. We don't expect any more likelihood of longer recovery truly. The difference in terms of common symptoms, if you have a vaginal birth, you're going to be more likely to experience urinary incontinence. And if you have a C-section, you're going to be more likely to experience pain with sex. That's a common symptom associated with cesarean recoveries. But pelvic floor PT can be massively helpful in addressing scar mobility, doing scar massage postpartum, addressing C-section scar shelves, if you're familiar with what that is, addressing pain with sex or any symptom that occurs. So really all I wanted to make sure people know is that C-sections are common. If they happen, they're not your fault. And there's tons that we can do to support you through that recovery as well.
Thank you. That's really important for you to share that. I think every single person I know that's had a C-section experiences pain with sex.
It's super common, super treatable, really treatable, but common.
Definitely. So, okay, so we are experiencing pain with sex and it's not our fault. It's something with our body. Like, what's the best way to communicate that? Has anyone asked you how to communicate that with your partner? Like, it's
I mean,
a hard subject.
Yeah, that's a great question. I mean, pain with sex can be really challenging for relationships and really challenging for intimacy. Particularly if there isn't really open and honest communication around, hey, this isn't comfortable for me, because there can be a lot of guilt associated with intimacy postpartum too. So I would say that if you're struggling to communicate that openly to your partner and you've tried to just be honest about what it is that you're feeling, there are amazing couples therapists and sex therapists out there who can help you navigate that challenge. The other thing that we've had people do that's been really helpful for our patients is bringing their, so pain with sex associated with a C-section typically gets better pretty quickly once we treat it. Like, I'm talking 1 to 2 months, people are typically pretty pain-free back to having enjoyable sex. So in that period, sometimes what we'll have people do is bring their partners into the visit so that the partner can also get a better understanding of why it's happening, what's going on, and what we can do about it. And also get the partner involved in the treatment if that's something that works for the couple. Not every couple wants that, but some people want to be able to work on it together so they feel like they're solutioning together rather than it being all on one person.
Got it.
But sex therapy is a great option if that is something that's really affecting the quality of your relationship. And though it's common, it is so incredibly treatable.
Totally. Okay, we have another question. Can you go back to talking about getting an eval while pregnant? She heard you say it's not recommended in the first trimester and that you guys won't do it in the first trimester, but is the second trimester eval okay?
Yeah, so we typically won't do specifically a pelvic exam in the first trimester. I will treat patients and evaluate them through pregnancy. The only reason we don't typically do an internal exam during the first trimester is because of the rate of miscarriage. It's not because it's unsafe to do a pelvic exam. We have no evidence to suggest that it causes miscarriages. People are still having sex. But if we do a pelvic exam and then that 1 in 4 person has a miscarriage soon after, the correlation is what we're concerned by. So that is my, like, this is my lawyer told me to kind of talk, not like this is unsafe medically. I will absolutely do it for a patient who needs it, who understands that that's the reason that we don't do it, and who consents.
Got it.
But yes, typically people also feel nauseous often through the first trimester. They're usually more fatigued. So folks also don't want to come in through their first trimester on average. I'm talking in like average, typical across the spectrum, but remember, every single person is different. So everything that I've said that sounds like a rule can be broken based on your situation. But usually if people are fatigued, if they're nauseous, if we kind of want to avoid an internal exam anyways, and they're asymptomatic, the first trimester, your body hasn't started changing a ton, especially in a first pregnancy. So we'll see them early second try.
Awesome, thank you. Okay, so we have 6 minutes left. So if there's any last minute questions, please put them in the chat. A reminder that this is recorded. Everyone will have access to the recording post webinar. So if you had a friend that could benefit from hearing all the amazing things Rebecca has shared, please don't hesitate to forward that to someone. You can find Rebecca on social media. I'll make sure you guys have access to all of her resources, her website, etc. So I want to ask you before we go, was there like one defining moment in your life that made you decide this career path for you? And if so, are you willing to share what that was?
Yeah, I mean, I'm happy to, but honestly, there wasn't. I got into physical therapy because I had my mom was in a really awful biking accident when I was 8. She broke her spine. She was in PT for many years, and then eventually she was my skiing partner, my rock climbing partner, my hiking partner. She made a full recovery after a lot of physical therapy. And so I think the idea of PT was always in my head, but I've also always been a feminist and a vocal feminist and really very pro reproductive rights and reproductive health and women's health. And so I think that as I started getting into the physical therapy world, I started out working with pretty high level athletes. I did a lot of work with ultra cyclists, with ultra marathoners. I started in that like high level sports performance world, and I started seeing pregnant people in that environment. And I started seeing my colleagues be like, what the heck do we do with these people? It's scary, they're pregnant. And I remember thinking like, that is unacceptable. We at 50% of our population can be pregnant. Like, how can we possibly not be equipped to deal with healthy athletes through pregnancy and through recovery? And so really like that was, if there was a moment, it was that moment, but there were a lot of things that led to it. And so
Yeah,
at that point, when I moved to Austin, I transitioned into pelvic health. And then soon thereafter, I transitioned into this like ortho sports pelvic health perinatal world.
got it. Cool.
Yeah.
Well, thanks for sharing that. Yeah, it
Well,
is crazy that like there's so little resources. Like, I have friends that are like, "Do you think it's okay for me to run a marathon pregnant?" I'm like, "Well, sure, but it's so crazy like no one's confident in doing certain things because there's so much conflicting information. So, and there's so much fear,
yeah.
and it's so frustrating because it's like, yes, we're pregnant, but like we can still live our lives and do things that bring us joy, and we shouldn't be afraid to do those things, obviously safely, but it's such a weird, it's so weird. It's like,
There, there's a lot out there about what is and isn't safe during
mm,
pregnancy, what kind of exercise is unsafe, what's safe movement. And the reality is like movement is safe, exercise is
mhm,
safe. We want to listen to your body. We don't want to have you run in 100-degree heat, but that's also probably true for a not pregnant person.
right.
And so I think that so much of the work that we do, and that's why so many people come to see us who are asymptomatic, they come in and they're like, I really want to do X, but I was told I shouldn't. And it's like, well, why were you told you shouldn't? Like core strengthening is the perfect example. Core strengthening during pregnancy is associated with so many benefits for health. And yet people have kind of been told like, don't strengthen your core during pregnancy. It'll give you a diastasis. It's unsafe. And so there's a lot of misinformation out there. And I think that it's getting better, but it's definitely something that we're up against when it comes to pelvic health and just pregnancy health generally.
Okay, so if of all the things you shared and all the things that we've heard you say, if there's like one thing you want all of us to like take away with today, what is it?
Um, my number one, I think based on our conversation, is that though I always sometimes I feel bad when I do these talks because like I want to give straight answers, but the reality is that health isn't black and white.
Totally. Yeah, especially
There's
not pregnancy.
Yeah, and I think that's the takeaway. There is no black and white, you should be doing this. Everybody should be doing this to support their birth, to support their pregnancy, to support their postpartum recovery. And anybody who's giving you like these are the top 3 movements for X, that might be true for some people and not true for you. So I just remember that pregnancy is a personal experience and your health is very personalized too. And while online resources and lists and programs can be really valuable, and I've created them, so I see the value in them, it's also important to remember that just because the general advice doesn't help you, that might just mean that that general advice wasn't what your body needed. So always, always, if you can, when it's possible, talk to somebody who can evaluate your personal needs and give you advice that can serve your body.
Do you guys have virtual services?
Yeah, we do. We treat people virtually all across the world, and then we treat people in person in our Austin clinic.
Okay, I was about to ask if they can be outside Texas, so you just answered that. Awesome. Okay, well, maybe you have some new patients in the next hour. Awesome. Okay. Rebecca, thank you so much for your time. This was so insightful, and I'm just so thankful for your honesty and everything you shared. It's just like extremely helpful, even for someone who isn't expecting. And I'm so grateful. So thank you so much.
Yeah, thank you so much for having me, and thank you so much for all that you do with Populist. It's such a cool, like, you have such a cool business, and you're spreading such important information. I'm just really grateful for people like you doing what you're doing.
Hey, I'm glad we can do it together. So it's the least we can do, right? There's so much more than just a registry, and like I'm just grateful that we've been able to curate a webinar series for things beyond just like lists of stuff, because it's so much more than that. So
But
cool.
I love the name solicited advice. That is solid.
It's good, right?
It's so good. It's so good.
Yeah, it resonates with everybody. So I think we landed on the right one. Okay,
Yeah.
well, there'll be a post webinar survey, and it's so helpful for you guys to take it, please. It helps us just restructure things, make sure we're providing you value. And I just love to see how we can improve. So thank you guys for your time. Be on the lookout for our post webinar recap and recording, and I hope you guys have a great weekend.
Thanks
Cool.
so much. Have a great
Thanks,
one. Thank you
guys.
for being with us.
Bye.